For those of you who have lower extremity lymphedema, the sequence is similar to upper extremity, except that you have to get the fluid up through the abdomen via the thoracic duct rather than just over the shoulder or across the chest. You will start proximally by clearing the left terminus. And since the lymph fluid from the entire lower body has to travel through the thoracic duct, the largest lymph vessel in the body, it is imperative that this is cleared next. We do this by deep diaphragmic breathing, which Leslie will be demonstrating for you. At the base of the thoracic duct is a reservoir called the cisternae chyli, where lymphatic ducts converge. Both this area and the two large trunks leading down to the inguinal nodes, these trunks are deep within the abdomen and we can't palpate them. However, we can make a difference through pressure. We facilitate drainage by using both hands, pressing down over these areas, first the cisternae chyli. As we exhale, we try to push our hands out of our abdomen as we inhale. I'm showing you this as I'm standing, however, it is much more effective if you're lying down. Now you just work your way down both of these trunks on both sides of the abdomen. I'm going to start here with the cisternae chyli. So I'm going to exhale. I notice my hands are going in over the cisternae chyli and I'm holding them there. Now when I inhale, I'm going to try to push my hands out with my inhalation. I let go, and now I start moving down on the right trunk. Inhale, try to push my hands back out. And when I get all the way down to the inguinals, now I go back up. I start here over the cisternae chyli again, and I do the same thing down over the left abdominal trunks. Now, these vessels are cleared and ready to receive lymph fluid from the inguinal collection area. You'll notice that I did this demonstration standing. You'll have much better results. It'll be much easier if you're lying down flat when you do that. But now you can move the lymph down to the inguinal lymph nodes on both sides if both legs are affected, or if you're transferring fluid across the watershed to the opposite side. Use your flat hands over these inguinal nodes and gently pump with the release toward those transporting vessels you've just cleared. It's pushing in and stretching and lift them up towards these trunks. Press in, it's pumping with the release towards here. The following sequence is similar to upper extremity. It's just that the pathway down to this area is a little more complicated because of its distance from the supraclavicular fossa or terminus, where the lower half of the body has to drain. If you're not able to get lymph through the inguinal collection areas, you may have to consider using one of these alternate pathways. So look at the watershed and you'll see the reroute or create a new highway across the watershed. It may be the transverse watershed just above your waist so that the lymph fluid can drain into your axillary nodes or across the vertical or the medial watershed over to the opposite inguinal collection area. Your therapist can help you map this out. However, I've noticed that sometimes with lower extremity lymphedema, I can still get some fluid through the inguinal nodes and reduce some of the load by rerouting the superficial fluid across the transverse watershed so that it can drain into either the right or the left terminus. Please note that the thoracic duct transports all lower extremity fluids up to the left terminus, unless you've taken it across this watershed. It re-enters the bloodstream via the subclavian vein right here. Also, once you begin MLD from the inguinal nodes on down, you will start at the top of your leg and gradually work your way down to the toes. Just remember, you'll always be working proximally to distally and routing fluid through lymph vessels that you have already cleared. You may choose to follow my SelfMLD and bandaging regimen exactly, or develop new techniques that work better for you. Your measurements will tell you if what you're doing is making a difference. Be sure to measure your unaffected limb also in case you are having a systemic reaction that is affecting both limbs. If you feel you're doing everything correctly and still not getting the results you'd hoped for, you may need to focus on the dietary choices that may be interfering with your progress. Consider eliminating gluten and sugar from your diet. I did. Just see what happens. If you're struggling with weight issues or a leaky gut, more appropriately called intestinal permeability, you might want to research lectins, as they may be causing as much havoc in your GI tract as the gluten. Once you realize how many lymph nodes are in your gastrointestinal tract, you'll understand the connection between a clean gut and clean lymph system. Be sure to stay hydrated. The older you get, the more important that is. Pure filtered water is your best choice. Just don't store it in a plastic bottle, and even worse yet, leaving the plastic bottle in a hot car. Try to avoid extended periods in the hot sun or excessive exercise. Both are essential, but only in moderation. Over the years, I've learned a lot about lymphedema. As a lymphedema patient myself, as a lymphedema therapist since 1992, as a nutritional therapy practitioner, as a patient educator for the Northwest Lymphedema Center, and as a cancer survivor, I'm still learning and grateful I'm now in a position to share what I've learned with others facing breast cancer surgery and axillary dissection who have similar challenges.